So the word suicide, the concept of self-destruction, is one that is serious on the range
Absolutely
of
serious.
when you should take action.
Yes.
Well, what kind of action should you take?
The very first thing you do is you talk to that person. People are afraid if you ask someone directly, have you thought about killing yourself, that you're going to put an idea in somebody's head. And frankly, anyone who's feeling bad has probably already considered it and is either actively considering it or has considered it and rejected it. So you're not going to bring up a matter that isn't already something the person's thought of. And it's best to say to them, I'm worried about you. Are you safe? Are you thinking about killing yourself? Are you thinking about hurting yourself? Being direct and honest is an absolutely good way to go.
So just say, are you thinking of killing yourself?
Absolutely.
Have you tried to kill yourself? Are you okay?
Mm-hmm.
Just something like that.
Just something like that.
Okay. So you do want to take action,
You
and you just ask some
absolutely.
questions.
Yes.
Okay. Now, for a lot of our audience, they are experiencing problems in life, but they probably have absolutely no idea what the reality is of working with a psychotherapist. Now, they've watched TV shows, and some of them are funny, and some of them are not. But I guess, are television depictions of psychotherapy accurate as a rule? And then second of all, what is it really like to go and sit down and talk with a psychotherapist?
Well, some of us collect images of psychotherapists and psychologists on TV because we're either so badly portrayed or so erroneously betrayed that we just keep a collection of all the misinterpretations that the media presents. One of the classic ones is kind of the arrogant, uncaring professional, and I imagine we're as capable of being arrogant as anybody else, but by definition, if you want to go to a good therapist, you want somebody who can talk to you. So we shouldn't be arrogant, and we shouldn't be arrogant when you meet us. The other one is the touchy-feely, stumbling nincompoop that just kind of, waves, has lots of candles going and New Age sorts of things and whatever, and really says nonsensical things that are intuitively obvious to everyone. And again,
After looking at the pictures in the wallet on television.
that's right, that's right.
Of course, my favorite on the other type of therapist was the one who actually gets up and leaves the room while you're talking, only coming back at the end. I saw that once and laughed too. But this is Hollywood. It's just entertainment, not the real world.
The closer ones have been the therapist in Sopranos is a little closer to how things might go. Billy Crystal did What About Bob was hysterical with the therapist that was too busy writing his book to bother with his patient. But so you have all those sorts of ideas out there. In terms of what really happens, typically what you'll do is you'll either have a referral from your physician or from somebody else that has seen a therapist that found it helpful, or a variety of different ways. You call that person and make an appointment, and you will go in and you'll do most of the talking. It's not like going to a medical doctor where a medical doctor will say, well, you do this, you do this, you do this, you call me and let me know if it's effective or whatever. Most of the time, because we don't have magic pills, and if we did, we'd give it to them and they'd go away and everybody be happy. But what we do is work collaboratively with someone, and actually that's called developing a working alliance. And what that means is that you and I would meet together, and the very first agenda would be for us to figure out together what we would do for you to reach whatever goals you had through meeting with me. So if you were feeling depressed, for example, then what we would talk about is how I might help you figure out some ways to go about feeling better than you feel now. And that's not simply a matter of me giving you advice, for example.
Great. And when we come back, we will be learning what kinds of things happen in life that drive people to seek the help of a psychologist. We'll be back in a moment with Medical Matters. Hi, and we're back with questions about psychotherapy and psychologists. Now, the question is, if you look at how patients come to visit a psychologist, is it that a life event, such as the death of a loved one or an unhappy marriage or the uncomfortable relationship or I'm in a job I don't like, is the visit driven by an event, or are events sometimes just triggers that seem to get somebody to feel more strongly that already emotionally just really isn't where they want to be? So is psychology, I guess, event-driven, or is there some other part of it that's general mood, too, along the way?
It's actually both. One of the first questions I ask patients when they come into my office is, what's the straw that broke the camel's back? What is the thing that finally made you pick up the phone and give me a call? And typically people will have one or two events that have happened recently.
Like what? What would be typical examples?
A big thing would be a particular argument with a spouse. If, for example, they're coming in for marital or couples therapy. Discovery of an affair, something like that, that's very discernible. Other people might come in because they've lost a loved one, or because they've been fired from their job. Variety of different things. Specific events might be the thing that brings them in. But when you begin to talk with people, what you find is that there almost always have been things going on for some time building up, and that finally there's some kind of a trigger that says, all right, helps a person say, all right, I'm ready to come.
Is being a healthy person a relative term?
Yes, of course it's a relative term. It's relative in mental health, I think, in the sense that we can be relatively odd-looking to others around us and be perfectly happy in our lives and have no need whatsoever for a psychologist. So I think there's really no need for you to come in if you're doing something in life that others find a bit odd, but you're perfectly happy with and it's not hurting anyone else. Of course, there's no reason to come see a psychologist. What people decide is a positive outcome from psychotherapy is a somewhat relative idea. And in fact, this has fueled a lot of the research in the area of psychotherapy and has confounded researchers quite a bit, because there are a variety of different ways to measure psychotherapy outcome, depending on what point of view you want to take. Are you better if you feel better as the patient, but you're still behaving in ways that make the people around you crazy or look dangerous? Do others think you're doing better, but you still feel pretty rotten yourself? There are objective measures, there are tests and other sorts of things that one can complete to measure improvement.
If we take a look at your understanding of mental balance, how does the use of illicit drugs, including heroin, cocaine, uppers, downers, ecstasy, marijuana, right down the line, how does drug use affect mental balance?
It's both cause and effect of problems. One of the things that you sometimes see are individuals who struggle with both either anxiety or depression, who use illegal drugs or use alcohol or abuse prescription drugs in order really to treat an underlying disorder, an anxiety disorder, a depressive disorder.
Like self-medication?
Like self-medication, that's right.
I don't think most Americans would look at it that way.
They certainly wouldn't, and
they're just thinking they're being very naughty.
They're either thinking they're having a good time, or they think sometimes, particularly others, think, well, they're weak-willed and they're not really taking very good care of themselves. When you get them in and you look and you take a look, I worked with a gentleman yesterday in my practice.
For more Medical Matters television shows, go online to medicalmatters.tv.